I have completed doing a trach suctioning for Mr. Smith here, and now I have checked the orders again, and Mr. Smith does need to have his trach cleared as far as getting a new inner cannula done, and so I have already checked the pain assessment, and he's not in any pain, and I provided privacy, and I have explained the procedure to him, as well as I have already identified the patient, as I said, that his name is Mr. Smith, and he was born on July 12, 1985, and he is not allergic to any latex, or he is allergic to some aspirin, though, but that's not going to bother this particular situation. And I've already performed hand hygiene, have my gloves on, entire PPE for precautions, as well as my trash can. So I'm going to begin. First, remove the oxygen off of him, and remove the bandage, as well as the inner cannula. Remove my gloves, wash my hands. Now I'm going to open up my sterile package for my tracheostomy. And this is not working for me right now. I'm going to go ahead and open up my inner cannula, pop that into my sterile field. Put on my sterile gloves. Before I do that, I'm going to go ahead and open up my sterile water, pop it open, pour it in to my container. Now put on my sterile gloves. What I'm going to do now is grab a hold of my inner cannula here. Making sure it goes in there. Using my Q-tips, sticking it in, wiping off. Going from inward to outward. Now I'll pat dry. Once more for good luck for him, just to make sure that he actually doesn't have any skin breakdown is really the reason why. And then put in the gauze in here underneath. Mr. Smith, you're doing great right now. Here. Okay. Now I'm going to remove my gloves and wash my hands, and then I will need the assistance of my handy dandy helper. Wash my hands, put on new gloves. And what we're going to do is we're going to remove the tie here from the old one. As my assistant, who is wearing gloves, is helping me with this. I'm going to grab my new tie before I totally release it. Move it through. Mr. Smith, are you doing okay? Yeah. Okay, good. assistant help me with removing that tie? My thumb is really wanting to stay with Mr. Smith here. There we go. Okay. Sorry, Mr. Smith, for having this on your face here. Get underneath this way. Tie it. Got that tied finally. All right, now I'm going to check to make sure I can get one finger underneath. Mr. Smith, let me get you to move your head. Good. All right. I'm going to go ahead and reapply the oxygen. And disconnected for you, Mr. Smith. Remove my gloves. Wash my hands again. Okay. I'm going to listen to Mr. Smith's lung sounds. And the lung sounds are clear. Okay. Counting his respirations. His respirations are at 16. O2 stat is at a 98. His oxygen tube and disconnected. Okay. Grab a hold of my equipment here. And lower the bed. Assess for his pain once more to make sure that he's doing okay. Put the bed back down at the position where it needs to be for all the way down. And then make sure that he's back in his regular, or in a comfortable position for himself. I also had him at semi-Fowler's, wash my hands, and remove all of my equipment. Give him his call bell, and wash my hands once more, because you can never be too careful in washing your hands. And letting Mr. Smith know that he can call me if he needs me.